Dr. VanDyke, board certified endocrinologist, back to talk about how do we live with thyroid nodules. So let's say that we had a nodule that was risky enough and big enough to get a biopsy on, okay? But that biopsy came back stone cold normal, and we're not worried about it. So typically when we have a biopsy that says, hey, this thing is negative, we really do expect it to stay that way. We do the surveillance of an ultrasound typically once a year to make sure that it's not doing something weird. Like we've said before, thyroid nodule, nice and smooth, low risk looking. We expect it to kind of grow a little bit, grow systematically. If it changes how it grows, we don't like that. All right. Maybe it used to be smooth and round and now it's like oblong, or it made fingers or something. We don't like that. Maybe the inside of the nodule was nice and smooth and uniform, and then one year it looks like it's got salt and pepper on the inside. And we don't like that either. So when that kind of thing happens, then we think, was there a little ditzel of cancer could be growing in there, but the biopsy needles happened to go around it. And then we want to recheck this thing. Otherwise, benign nodules that really kind of don't grow that much or encroach on any structures, you just kind of live your normal life. If a nodule's getting big enough that it's causing obstructive symptoms, again, that's like problem swallowing, changes to your voice, maybe cosmetically you can see this thing, or it's pressure when you're trying to lay down and sleep at night, then we talk again about, should we do something about it? You don't have to have cancer to go have the thing removed, and you certainly don't have to have cancer to have a radiofrequency ablation. That's ideal for benign nodules that are in your way. So there are options about living with nodules that are uncomfortable, and we can feel very reassured that when a biopsy says, hey, this thing is benign, that we expect it to stay that way.